This is Mark with Miramar College, and today we're talking about the medication administration for epinephrine. What you see in front of me right now is the epinephrine auto-injector skill, but you can also think of this skill as part of the medical assessment. Just replace standard precautions, scene safety with the field impression. Now, when you get down to the field impression, you're basically going to state the signs and symptoms that the patient is experiencing and then also include a little bit of the pathophysiology behind it. So you want to include that they're showing signs and symptoms like facial swelling, flushed skins, rapid weak pulse, stridor, wheezing, hives, itching, everything you see listed here, and then talk a little bit about the pathophysiology. So this is in anaphylaxis, there's a histamine release that causes vasodilation, capillary leakage, bronchoconstriction, and increased mucus production. Once you talk about that, and you have your medication selected, so obviously we're using epinephrine for these signs and symptoms, you're going to state the protocol S122 for allergic reaction anaphylaxis specific to the use of the epinephrine auto-injector. And that protocol states that if available and trained, you may administer one dose of 0.3 milligrams epinephrine via auto-injector intramuscularly one time. Any repeat orders requires base hospital contact. And then you want to state the actions of epinephrine. So epinephrine is a vasoconstrictor, bronchodilator. Side effects are going to be tachycardia, maybe some anxiety and palpitations. Then let's go through the 5 rights. So remember, for the 5 rights, PM Dre, right patient, they're showing signs and symptoms of anaphylaxis. Right medication, this is epinephrine to counteract the effects of the anaphylactic reaction. D, dose, 0.3 milligrams for the adult patient. That's anybody over 66 pounds. For pediatrics, it's going to be half that, 0.15. But right now, this is an adult patient. Route intramuscularly into the lateral thigh, and then you want to make sure that it's not expired. You verbalize a triple check by saying, I'm going to have my partner verify the 5 rights again. Once they hand it back to me, I will once more verify the 5 rights for that triple check. And then you will correctly administer the epinephrine via auto-injector to the lateral thigh of the patient. So you take the safety cap off of the pen, you hold it firmly in your hand, you instruct the patient to give themselves a hug so that they don't swat your hand away. You hold the inside of their lower thigh, and then you hit the epinephrine auto-injector with that orange deployment tip where the needle is going to come out about halfway down the thigh. You want to make sure that there's nothing in their pockets. You want to make sure no wallet, no phone, no keys. Ideally, this would be given on bare skin, but the needle is pretty large. It's designed to go through clothing as well. Once you administer, you're going to place that in their skin for 10 seconds. So you're leaving it in place. Once 10 seconds passes, you place the auto-injector into a Sharps container. Now, how do you assess the patient to determine that the medication is working? You're going to reassess breathing, lung sounds, pulse oximetry, blood pressure, and pulse. And that should all be stated as part of your reassessment anyway, because this skill fits very nicely into the medical assessment. Like I said, it's right in between vital signs and reassessment. So that's how you would give epinephrine via auto-injector for the EMT skill, as well as the medical assessment. If you guys have any questions, please let me know. Send me a message on Canvas or leave a comment down here. Thank you and have a nice day.